Nursing is an international issue, and therefore trying to ensure that we have a common voice across the whole of the world is essential, in part because in many areas nursing doesn't hold the esteem that it does in places like the UK. So being able to support our colleagues across the world in developing common standards, developing common outcomes and research is essential. Whilst there are some common health challenges across the world, there are also some significant differences as well. If you take the situation in Europe, where often the issue for us now is non-communicable disease, whereas in other parts of the world it will be the issues of dealing with famine and poverty. Being able to draw those different strands of nursing for the world's nursing organisations to learn from each other is essential. Being able to share that across Europe is a good starting point, because even within Europe there are significant differences between the way that nursing education is developed, where nursing practice is developed. Creating a common voice for that is something which is incredibly useful, not just to nursing, but more importantly for the populations that we serve. For Europe, there are a number of things that are emerging. Firstly, we're seeing a move away from communicable diseases, so the issues such as TB, cholera, etc. Are still a challenge, but they are nowhere near the kind of challenges now that non-communicable diseases, long-term conditions such as diabetes, issues for us in terms of people being obese and associated conditions are now significant challenges for us. We're also seeing that mental health doesn't have parity of esteem with physical conditions, and therefore across Europe trying to ensure that people have a better understanding of mental health problems, that people are able to seek support and advice and treatment at an earlier stage is essential. The other area that's emerging for us is with the number of areas of conflict across the world, we're seeing increasing migration into Europe through individuals who have lost everything from the countries that they've fled from, and therefore we are having to try and provide high quality care to those individuals, and that's including dealing with the mental health issues from the traumas that they have suffered in places like Syria. I think one of the key things about it is the ability to take a look at how we develop the nursing workforce for the future, how we develop the evidence base which demonstrates the differences that nurses can make in preventing health problems, in treating health problems, and in providing long-term care for those conditions that we can't treat and cure. Being able to share the experiences that we have has led us to develop something which I think will be incredibly helpful to nursing in the future.